Hello guys, my name is Carla Abelan and today I'm gonna be talking about my experience at the Rehab Hospital of the Pacific. The Rehab is one of the best acute care rehabilitation hospitals in Hawaii. Their mission is to rebuild the lives of individuals, families, and communities by providing excellent patient care services for those with physical and cognitive disabilities. When working at the center, I was helping the food service department in many tasks such as collecting menus from patients, preparing the trays, helping in the kitchen, among others. During my time at the rehab, Susan Asado was my supervisor. She is the general manager of the food services department. She graduated in food service and management and has been working at the rehab for over 10 years. First, she started in the food service industry. Then, she became food service manager and now she's the general manager. Some of her duties at the rehab include scheduling, supervising, and hiring workers, in addition to keep track of inventory and ordering food and supplies when needed. The learning objectives set to achieve during my volunteering at the rehab include to gain experience working with patients by selecting and collecting relevant information such as allergies when getting new admissions. My second objective was to effectively address specific diets to each patient by understanding their needs. For example, patients with dysphagia will need a means texture rather than the regular texture because they have difficulty swallowing. Another objective was to learn more about working in a clinical environment by observing clinical professionals such as nurses and physicians at their workplace. One of my main objectives was to improve my communication skills, especially because I'm a foreign student. Different ways to do that was using medical terms, ensuring proper and clear communication, as well as being an active listener when talking to patients or coworkers. The last but not least objective was to ensure that patients follow their established diets by correctly preparing their trays and reviewing that their menu selection is adequate to their specific diet. So, for example, making sure that a patient that is following a cardiac diet chooses the options with low cholesterol and sodium. Among all the objectives, I selected gaining experience working with patients because, first of all, it's a skill most useful for my future career goals of becoming a nurse. Secondly, by working with patients, I improve my communication skills and also help me learn medical terms. And it's the part of my volunteering that I enjoy the most by meeting new people with many different stories. And also by talking to patients, I could share the knowledge learned in my nutrition classes. So definitely this was my main objective of the whole list. A recommendation I have for other students is to volunteer at the Rehab Hospital of the Pacific because it's a great way to give back to the community, meet people from different backgrounds while getting professional experience on your field. If you volunteer at the rehab, you will be surrounded by kind, dedicated, and caring people that will help you at all times. So definitely you should volunteer at the rehab or any other center that can provide you with professional formation while also enjoying your time there. I really recommend that experience. Mahalo listening to my presentation. Let me know if you have any questions. I will leave my email on the next slide. Thank you.